Doctor, between young and old patient, while doing bypass, who do you find out which easier way to operate?
Dr. Krishnan, that's a very important and interesting question. So, when I operate a young patient for a bypass or an old patient for a bypass, frankly, I feel the younger ones are much difficult to operate. On the contrary, I mean, people would actually think a young patient is healthy and is a much easier patient to operate. I find the reverse is true. The old patients have disease which are proportionate to their age. They have a lot of calcium in the coronaries. The coronaries are the arteries which supply blood to the heart. There is a lot of calcium over it, but the remaining part of the vessel usually is of a good caliber and of a good quality. And we can do good bypasses on them. But when it comes to these younger patients, I have seen that the blood vessels itself are very shriveled and they have constricted. And there is a lot of calcium at places. I mean, you recently know the case that we did the other day, a 40-year-old.
Yeah.
And he had so much of calcium that we actually had to cut calcium from two vessels and then do a bypass, which is called a coronary endarterectomy. So obviously, this is expected, and that is the reason why they are having such a bad disease at a younger age. So most of these young patients either have a family history or are into addiction or are diabetics. And all these three, apart from stress, which is another important factor, but I don't hold it against them because stress was there in the earlier generations also, just that the present generation probably is not able to handle it better and they get more into addictions. So due to all these factors, we have very bad coronary artery disease in these young populations, a lot of young heart attacks happening, and obviously these are terrible patients to operate. But yes, with the expertise that we have, our hospital has a very good ICU setup, we have excellent equipments in the OT, I think we do a good job, right?
Yes.
Thank you.